Welcome to Ophthalmology Online Classroom. Today we will talk about the anatomy of cornea. The learning objectives of today's lectures are shown in the slide. As you know, the cornea is a part of outer fibrous coat of the eyeball. This fibrous coat has two parts. The posterior part, which is the white part of the eye, is seen from the front and continues till the back of the eyeball is called sclera, and the transparent anterior part is called cornea. As cornea is a transparent structure, so the colored structure which is present right behind the cornea called iris is visible grossly with the naked eye. The junction of cornea and sclera is called limbus. This is limbus here. If you divide the external layer into 6 equal parts, the posterior 5 parts are the sclera, and the anterior 1 part is the cornea. So we can say that cornea makes anterior 1/6 of the external coat and sclera makes the posterior 5/6 of the external fibrous coat of the eyeball. So cornea is an avascular transparent structure with smooth convex outer surface and concave inner surface. Now the functions of cornea. As you know, the cornea is a part of external layer, so one of its main function is protection of eyeball. But besides providing the protective interface, the cornea acts as a powerful refracting or optical surface. It allows the light rays to enter into the eye. When these light rays crosses the cornea, they change their direction and they bend or converge. Then these partially converged rays enter into another transparent structure which is called crystalline lens, which further converges the rays, and both these structures helps to focus the rays on the retina for image formation. This is retina. The refractive power of cornea is 40 to 43 diopters, which accounts for 70% of total refractive power of the eye. The total refractive power of the eye is 60 diopters, out of which cornea provides 40 to 43 and the remaining 18 to 20 diopters is provided by the crystalline lens. The shape of anterior corneal surface is slightly elliptical. Elliptical means its vertical and horizontal diameters are not equal. The horizontal diameter is slightly bigger than the vertical diameter. Vertically, it is 10 to 11 mm and horizontally it is 11 to 12 mm in diameter. It happens because of sclerization, which occurs in the superior and inferior parts. Or we can say that scleral tissue is slightly overgrown here superiorly and inferiorly, causing the vertical diameter slightly smaller than the horizontal corneal diameter. But the posterior surface of the cornea forms a complete round shape, where its diameter is 11.5 millimeters. When the horizontal corneal diameter is less than 10 millimeter, we label the cornea as microcornea, and when the horizontal corneal diameter is greater than 13 millimeter, we call it as megalocornea. Now the radius of curvature. The cornea is actually aspheric. It means the curvature changes throughout the surface of the cornea. It is steepest. Steepest means more curved, more convex. So it is steepest in the center, and as it moves towards the periphery, it becomes flatter. The most steepest part is the central 3 to 5 millimeters. See, this is the central steepest part and it is the optical zone of the cornea. The average radius of curvature is around 7.5 to 8.5 millimeter. Now the thickness. The central cornea is about half millimeter thick with an average of 540 microns. As it moves towards the periphery, it becomes thicker. Here you see the thickness is around 0.7 millimeter. and at the limbus it is around 0.9 millimeters. Now the histology of cornea. Histologically, cornea has three main layers. Outer is the epithelium with its basement membrane. The middle is the stroma with its condensed part called Baumans layer, and innermost is the endothelium with its basement membrane called Desmos membrane. For the sake of simplicity, many books have described 5 layers of cornea, which you can remember as A, B, C, D and E, where the A is the anterior epithelium, B stands for the Baumans membrane, C is the corneal stroma, D is the Desmos membrane, and E is the endothelium. In recent past, another layer is identified which is present in front of Desmos membrane, and it is called pre-Desmos layer or Desmos layer. It is published first time in 2013. Now we briefly discuss these layers one by one. So the outermost layer is the epithelium. It is 50 to 90 microns thick, stratified, squamous, non-keratinized in nature. It is arranged in 5 to 6 layers. And the property of epithelium is that it sheds at regular intervals, and it is completely replaced with new layers of cells at around 7 to 10 days. Now the cell types of corneal epithelium. Epithelium has 3 types of cells. Innermost cells are basal cells. They are tall columnar cells and arranged in single layer. These cells have strong mitotic activity. They proliferate and regularly forms the new cells. And as the new cells are formed, they push the older cells forward. And as the cells move forward, they change their shape and becomes flatter. In middle layers, they transform into cuboidal cells, which are arranged in 2 to 3 layers, and here they are called wing cells. And as the cells move towards superficial layers, they become flat and forms squamous cells. These squamous cells are also arranged in 2 to 3 layers. The most superficial cell layer of epithelium is covered with microvilli. This microvilli helps to increase the surface area of corneal epithelium. And these microvilli are covered with glycoproteins and glycolipids, and it is collectively called glycocalyx. These microvilli are in close contact with the precorneal tear film. Here is the precorneal tear film. So they helps to stabilize the tear film and keep it adherent to the surface of cornea and helps to provide the smooth corneal surface. Now the functions of epithelium. The primary function of corneal epithelium is that it acts as a barrier between the external surface and the deeper layers of cornea. And it does this with the help of junctional complexes, which prevents the passage of materials to the deeper layer. These junctional complexes consist of tight junctions, desmosomes, and the hemidesmosomes. Tight junctions are also called zonulooccludins, and they are present between the superficial cells. The desmosomes are present in all 3 layers, and the hemidesmosomes are present between the basal cells and the basal lamina of epithelium. There are other type of junctions which are called gap junctions. They allow the materials to pass between the cells. So they allow the cells to communicate with each other. These gap junctions are only present between the wing cells and the basal cells of epithelium. As we move inside, the next layer is Baumans membrane. As I told you before, it is not a true membrane, but it is actually the condensed part of corneal stroma. It does not regenerate once it is damaged, and it is thick and strong membrane, so it basically provides support and resistance against injuries and pathogens. Then comes the main stroma. Stroma constitutes about 90% of total corneal thickness. See, this is epithelium, this is stroma, and this is the single layer of endothelium. And this stroma is made up of collagen fibrils, which are embedded in the ground substance. The stroma also has a specialized cell types which are called keratocytes. These keratocytes are also connected with the gap junctions. The function of these keratocytes is that when the corneal stroma gets damaged with any type of injuries, these keratocytes transformed into fibroblasts and they help in the process of healing. The ground substance is made up of glycosaminoglycans, which are keratin sulfate, chondroitin sulfate, and the dermatin sulfate. The collagen fibrils are embedded in this ground substance. These are arranged in bundles. These are bundles of collagen, which are called lamellae. And the arrangement of these lamellae are important in maintaining the transparency of cornea. The fibers in these lamellae are of regular size and they are arranged in a regular manner. They all are parallel to each other and one lamella is perpendicular to the other. So this is the main difference between the sclera and the cornea. Scleral stroma also has the same structure, but its fibers are arranged in a haphazard manner and they are not of the uniform size. That makes the scleral tissue opaque while the cornea is transparent. If this spatial arrangement of corneal stroma is lost due to any reason, like in case of injury, the structure of stroma becomes modified and we get opacity in the cornea. And another factor which helps in maintaining the transparency of cornea is the relative dehydration of the cornea. The water content of the cornea is 70% of its total weight as compared to the tear film and the aqueous. Both the tear film and the aqueous have almost 100% water content. This factor is also important to keep the cornea transparent because the relatively less water content keeps the layers of the cornea intact. Then comes the Desmos membrane. Desmos membrane, as I told you before, it is the basement membrane of endothelium. This is very strong elastic membrane which is made up of collagen and the glycoproteins. It becomes thicker with the advancing age and it continues to grow throughout the life. It is a very strong membrane and it provides resistance against the injuries and infections. Then comes the innermost layer, which is corneal endothelium. This is the single layer of hexagonal cells and their density is highest at the birth and it continuously reduces throughout life. It does not have the property of regeneration. When the endothelium is damaged, what happens that the surrounding cells becomes bigger in size and it fills the gap of the damaged area. And this process is called polymegathism. At birth, the density of endothelial cells around 6,000 cells per square millimeter, which are reduced to 4,000 cells per square millimeter in early period of life. In adult life, the number reduces to 2,500 cells and which further reduces up to 2,000 cells per square millimeter in old age. If the number of cells reduce to less than 1,000, the cornea starts losing its transparency. And once the number of cell count reaches to 5,500 cells per square millimeter, it becomes opaque. Now the functions of endothelium. The cornea is protected anteriorly with the epithelium and posteriorly with the endothelium. Both act as a mechanical barrier and they prevent the water from entering inside the cornea. Endothelium also has the junctional complexes. Beside these, there is an active energy pump which is called sodium potassium ATPase pump, which continuously pumps the fluid out of the cornea. So the endothelium keep the cornea in dry and dehydrated state, and thus it helps to maintain the transparency of cornea. Now the blood supply of cornea. The cornea is an avascular structure except the peripheral cornea, which is supplied by branches of anterior ciliary vessels. Small loops of these blood vessels are derived from the anterior ciliary vessels, and they invade the periphery and they supply about 1 millimeter area inside the limbus. Actually, these vessels are not in the cornea, but they are in the subconjunctival tissue which overlaps the cornea. As cornea is avascular, but it requires energy to fulfill its metabolic needs. So it derives energy from oxygen, glucose, amino acids, and other nutrients. Oxygen is absorbed through atmosphere through the tear film, and the smaller amounts of oxygen are also supplied by aqueous and the limbal vessels, while the glucose, amino acids, and other nutrients are supplied by the aqueous humor, with the lesser amounts from tear and the limbal vessels. Now the nerve supply of cornea. Cornea is highly innervated and one of the most sensitive tissue of the body. Its sensitivity is many times greater than the sensitivity of skin. It is supplied by long and short ciliary nerves, which are the branches of ophthalmic division of the trigeminal nerve. And most of these nerves are concentrated in the anterior stroma beneath the Baumans membrane, and they send their branches forward to form the subepithelial plexus. So whenever there is some injury to the epithelium, even the simple abrasion, these nerve endings get exposed. And it's a very painful condition. Patient experience severe pain if there is a little damage to the corneal epithelium. Now the factors responsible for maintaining the transparency of cornea. We have already discussed all these factors in our lecture. Just to revise and compile, these are the tight junctions in epithelial cells, the uniform structure and the regular arrangement of stromal fibers, relative dehydration of cornea, scarcity of cell nuclei in the stroma, avascularity of the cornea, absence of pigments in the cornea, and finally the pumping action of endothelium.